Hey, are we live? I'm so sorry. I missed my cue. Good evening, everybody. Hey, sis. Hey. I'm usually woke this time of night. It's the mornings that I don't do so good. Um, in any event, good evening, sisters, circle brothers, circle kids. I'm so happy to be here this evening to have an opportunity to connect and chat with you guys. I am Dr. Chris. I volunteer with the School of Health and Wellness alongside Dean Lestar, as well as Dr. Tam. And recall that we have a number of other wonderful volunteers that aid us in a number of things that we're getting ready to roll out. But for this evening, it is my pleasure to be able to come before you and introduce Crystal Montague. Crystal Montague, I want to share a little bit about her from the perspective that I want you to understand that she is a subject matter expert when it comes to mental health for children and when it comes to what she is going to share. You guys are in for a treat. You guys have access to someone who know what they're talking about. It's very important. She is the owner and chief medical director of psychiatry at Mindful Innovations in High Point, North Carolina. Her area of expertise is around psychiatry, behavioral, and mental health services. The particular clinic that she has founded and established also does offer convenient primary care services. Just to give you a rundown of all the things that she has done for several years and offers with her site, include psychiatric assessments, evaluations, ADHD, and TOVA testing. She treats children and adolescents that have ADHD, anxiety, depression, trauma, or behavioral disturbances. She works with social services, group homes, and provides AFL medication management services, Suboxone initiation and management. She makes referrals for psychological testing as far as IQ testing, autism, Asperger's, learning disorders. Crystal, from an academic standpoint, has her Master's of Science in Nursing with the FNP concentration, Family Nurse Practitioner from WSSU, as well as a Master of Science from South Alabama with a specialization in psychiatry and mental health. She is currently completing her doctorate of nursing practice, and she's looking at the social deprivation and depression in adolescents during COVID. So again, I said that to say we have an expert with us this evening. Crystal has worked in the healthcare industry for decades. And so it is my pleasure and my honor this evening to have her here, to introduce here, to be able to share so that you guys have an opportunity to talk to someone and have her impart to you tonight. So without further ado, I'm going to turn it over to Crystal Montague.
Hello, good evening, everyone. Thank you for joining in on this discussion. I believe it's a very important discussion. It impacts a lot of our youth. First of all, we're going to discuss autism. Autism is, what is it? First of all, it is a psychosocial disorder of communication and interacting. Oftentimes, we see when a child presents to us with poor psychosocial skills, they often want to self isolate. They prefer to be with peers a little bit older than them. They don't want to be with peers within their age group. They have distinctive boundaries that they have established. They do not want to play or interact with peers within their age group. Oftentimes, they do not make contact with people, even their own peers. They also may have lack of communication, poor communication skills. they may be behind in their language development, in the stages of growth and development. And oftentimes they may be receiving speech therapy. It's not called by the pediatrician. And maybe the teacher may see that the child has some delays in certain areas, but and then they're referred to us in an outpatient setting by either their teacher may bring it up to the parent, or they may tell the parent, well, you may want the pediatrician to explore these areas a little more. They have a lot of anxiety. That's one of the symptoms. They may chew on things, bite on their nails a lot, have a lot of avoidance behaviors. At home, what we usually should suggest is to give them their space. Don't try to force them into things. Let them roll by the beat of their own drum, so to speak, and just allow them to function how they please. From a professional standpoint, if you see that some of the symptoms are not manifesting or going away like they should, then we always say, well, therapy is the first line of treatment. It's the first line of treatment for any mental health disorder. We do not pursue any type of medication for a child with autism. Also, we oftentimes say, send them for a psychological evaluation. Now, in the school systems, the school will provide psychological evaluations, but for my patients, I like for them to do independent psychological evaluations, so that would eliminate any bias. When the school system completes psychological evaluations, oftentimes there may be behaviors that a child with autism may be displaying. Besides the anxiety, there may be some other behaviors that may be some aggression, maybe some agitation, because like I said, they want to define their space and they do not interact well with others. So you want to have a non-biased evaluation completed. And I usually say complete that independently apart from the school. So management of autism is usually what we consider applied behavioral analysis therapy, APA therapy, to help teach the psychosocial interactions and help develop and bridge those gaps where they may not be there. So that's a quick synopsis of autism. Now we're going to move on to anxiety. Anxiety in children is not seen as it appears in adults. We have the ability to think in a more abstract way. So a lot of times, depending on the age group of your child, we always say, children doesn't have logical thinking until around maybe you may see it around 9, others may develop around 10. But if they haven't developed logical thinking yet, they may not understand what anxiety really is, especially if they have endured certain circumstances that has triggered them to have anxiety. So anxiety is an impending state of fear or an impending state of doom. Some of the symptoms that you may see in children is irritability, agitation. They may lash out. They may want, again, isolate. They may bite on their nails. They may chew on their lip. They may be really fidgety and restless. We see that a lot in anxiety. They may not have the ability to concentrate or focus well. It may impact the gut, can be impacted, the GI system in the form of them not being able to eat well. You may see their appetite decrease. It also can impact their sleep hygiene. They may not sleep well. And those are some areas that we see. Now, home strategies is to make the child feel that they're in a safe environment. Whatever the trigger for their anxiety was, you have to coach them into thinking that the fear is no more, is not there, it's never going to come back. And just keep re-emphasizing that to them so that they can understand that the home is a safe place. You don't have to be afraid. And some children have anxieties that impact them when they get ready to leave home, and home is the safe place. And if they do have that, then it may take some time for them to develop, a routine of being able just to get out the door. We do see that a lot. When to seek professional help is when you do see that the child is having tremendous or significant impact in their daily functioning. They have issues with getting up, getting out of bed. They don't want to do it. They're almost, fighting you not to do it because it may be something at school that's going on that's provoking the anxiety. Bullying, we see that a lot. And to the point where a child does not want to leave home to go to school. Just with the pandemic, we saw anxiety a lot with that, children not wanting to leave home. Also, if I'm seeing a couple of questions come up, what does it mean if your child put anything in their mouth to chew on it? Well, if it's an object that is a non-food substance, then that's another condition called pica. So oftentimes we have children that chew on crayons, they may chew on pencils, they may chew on their clothing, they might bite holes in their clothing. That's an anxious tendency as well. And that goes up along with the anxiety umbrella. So we do explore what is causing it, what's the underlying cause, so we can try to fix it. As educators, what can you do to help students who struggle with anxiety? That's another question that I'm seeing. As an educator, you will have to probably give that child a break. You may have to take them out of the classroom or whatever trigger it is within this classroom that's triggering the anxiety. You may have to eliminate the trigger from the student. Oftentimes, that's what we suggest as mental health professionals. Give them 5 minutes that they can just regather their thoughts and calm down and just be able to relax before they go back in. That's one suggestion. A lot of times in schools, we advocate for what's called a 504 plan for children that has extreme anxiety, to be able to have a 5-minute break or to be able to go to the guidance counselor if they're seeing that they have certain issues with anxiety, or maybe go to their counselor. It's just all different scenarios that we put into play, and it take of a team of us to work together to develop what that special plan is for each individual. Also, when to seek professional help, like I said, is when you see it impacting the child's daily functioning. Anticipated testing and management. Like I said before, therapy is the first line of treatment. If a child has been in therapy for, I would say, about 6 months, almost a year, has not progressed to where, the coping skills, the coping mechanisms that therapy has set in place, and they are still having the same extreme anxieties and issues, then we may have to pursue medication management at that point, to help calm them down and for them to be able to function. Will the medication be there forever? Probably not, because they are likely to grow out of whatever is causing the anxiety. I'm seeing another question. Are there schools particularly for children with autism instead of bringing in specialists during class time at a public school? Absolutely, there are. You have Lionheart Academy. Herban Metz is a school offered under Gifford County umbrella, Gifford County Schools, that is strictly for children with autism. Lionheart Academy unfortunately, is a private school, but they do have scholarships and special funding for people who may need it. There are other schools out here. It's 2 other schools that I'm not quite thinking of right now, but I can get you that information. On to the next slide. Depression. I call depression the Nest Sisters: hopelessness, worthlessness, and helplessness. It is being in a state of a depressed mood where you have lack of motivation, lack of interest, and also not the social children. And this is children also. Children have the tendency to want to self-isolate. That's one of the number one things that you will see in a child. Children, especially young males, from 10-year-olds to 17-year-olds, are highest risk for suicide. And that's a statistic that is still prevalent today. So you have to watch a male child that has severe depressive symptoms and get them some help right away. Depression in a child you can also see mood swings, because like I said, in the younger children, the younger population, say if it's the loss of a loved one, or it's a divorce that's going on in the family, a relocation, just significant change that interrupts their functioning, it can bring about mood changes in that child that cannot logically understand why. Why is my father not here every day? Why did we move and I don't know anyone and I have to meet new friends, or they don't get along well with the friends that they're meeting? Just any major disruption can cause depression in children. Also, like I said, death and dying. Children doesn't really know how to process that well. So it's really hit or miss with them. Signs and symptoms, like I said, is self-isolation, agitation, mood swings. You may see crying spells. It can impact their appetite. Mental health in your GI tract has a lot to do. They coincide. Oftentimes we see children not being able to sleep well, or they may want to lay in bed and sleep all day. So it can go back and forth. Home strategies. Pay attention to cues. If there's a big major change for you, or divorce for you, or a major breakup, or anything that's going on in your household, believe me, it's impacting the child as well, or your children as well. So you have to be in tune with your children, even though we oftentimes think about ourselves and knowing that this is impacting me. We have to stay in tune with our children because it does impact our children. So pay attention to your children. Make sure that you are looking at them, watching them closely, and knowing that, hey, this is not right. They're not coming out. They're not interested in things that they normally like to do. And they just seem like they're not like themselves. Go get some help. Talk to someone. Get them in counseling. Get them in therapy. Sometimes children will not open up, but oftentimes they will. There are different types of therapies or strategies that the therapist will use to get them to open up and talk and speak. So definitely reach out to therapists. Now, anticipated testing and management. As far as testing, we use certain screening tools, and the screening tools are called patient questionnaires for depression. We also use it for anxiety as well. But if they score a certain category from mild depressive symptoms to moderate to severe, that depends on if we're going to recommend, hey, yeah, this child may need a little bit of medicine to help. But medicine is always our last resort. So that's depression in a nutshell. ADHD, attention deficit disorder. Attention deficit disorder is very, very common. And now is a good time with school starting back for parents to be in tune with ADHD. ADHD, it has about 4 distinctive symptoms: poor concentration, poor focus, short attention span, and becoming easily distracted. If you give a child 3 tasks to do that you suspect has ADHD, and slowly tell them those tasks and see if they can complete them all, and if they leave something undone, oftentimes that's a good indication that they may or may not have it. But there is testing that we do for ADHD. We definitely, some of the other symptoms that you may see in children: poor impulse control. They may not think about things quite think things clearly before they do it, whether it's a good decision or a bad decision. So they're usually very impulsive. They are very fidgety, doesn't like to sit still. So usually that's when teachers are cued in on, okay, so this child can't sit still in their seat for very long, and their attention, if something flies by the window, there they go. Their attention is off them or off the test in front of them or whatever they're doing in the classroom. They may forget things. They may lose things a lot. They may present as forgetful. I'm not talking about selectively forgetful, like when you tell them to do a chore, but just forgetful in general. And you're like, what? Now I know you're 10 and you can't have Alzheimer's, but just forgetful in general. They may make careless mistakes and just moving too fast. Their brain is moving faster than what it really needs to be or intending to. So they may make careless mistakes on things, and also may have some difficulty um, taking turns and just doing things that some behavioral things may come into play. So oftentimes they may get in trouble at school because their ADHD symptoms may linger over into some behavioral issues. So home strategies. Children with ADHD require a lot of redirection. Oh, and one more symptom, they may be very talkative. They may just be a chatterbox and talk a lot. So they require a lot of redirecting. You may have to tell them 2 and 3 times to do things. And it may be upsetting to do that. But they may be feeling like, well, I'm getting yelled at a lot. But it's really the attention deficit because, believe it or not, their brain is not processing what they're being told until they are told 2 and 3 times to do something. So redirection. Oftentimes I tell my parents, put up a dry erase board or some type of board at home and write down daily what they need to be doing. Because not only that, it provides them direction, but it also provides accountability. It puts the ball in their court to make them accountable for what they really need to be doing. And that's with therapy in place or with medicine in place, because you're still going to have the issue of the symptoms peeking through, even if they do get therapy or have medicine. The symptoms are not going anywhere. They're still, they will get better, but they're still going to be there. So I'm getting a question. How can you tell the difference in irresponsible teen and ADHD symptoms? Well, I oftentimes say if the teenager is just irresponsible, then they often avoid things that they really don't want to do. So then it's defiance. So if it's chores or if it's things that that they really do not want to do, homework is one. As they get a little older, even younger kids, some of them, they don't want to do homework. They'd rather get on a video game. We're in a world of electronics, so kids prefer that over than doing what they really need to be doing. So I oftentimes say limit the electronics to maybe 1 hour, no more than 2 hours a day. And even kids with ADHD, you need to limit it even more and probably reserve them on the weekend as a reward for them more than just giving it to them, letting them have it, because what you give them is going to become habit, and a habit becomes an expectation, and an expectation becomes an entitlement. And there goes to your behavioral issues once you begin to try to take it away, or you take it away in general. So, and that becomes an issue. Testing for ADHD, we have a couple of things we do. We do Vanderbilt testing that's been out for a long time. It's just a checklist that is completed for children with ADHD. We also do another test that's called a quotient test or a TOVA test. So those are electronic tests that actually read the prefrontal cortex of the brain, which is right here. And that's your ADHD center for everyone. So those tests will really give us a defined diagnosis whether or not that child has ADHD. The most definite test is a psychological evaluation. So we send children to psychologists to complete a psychological eval to know if they have ADHD. So if your pediatrician has checked off if they have ADHD, then they did what's called a preliminary test. So by the time they come over to us, we may test them again just to make sure, because it could be anxiety, it could be ADHD. So let's see. I'm getting a question. Is there anything you can do dietary wise to help young kids who may show possible symptoms of ADHD? Okay, so yes, you can. So some dietary things you can do. Naturally, fish oil has proven to show benefits in helping with focus and concentration. So depending on the age of the child, fish oil is a natural supplement that can be utilized. Also, lay off the caffeine, no sodas, anything like that, of course. So we definitely limit the sugars as well. We do not want to increase their sugar intake, especially if they have hyperactivity, because that's just speeding up the motor and they need to slow down a little bit. So those are some strategies that we always say. All right. So let's see. The next topic is called Oppositional Defiant Disorder. So Oppositional Defiant Disorder, or ODD, is very common in children. It's a behavior disorder. It is mostly diagnosed in childhood, and we see oppositional defiant disorder kind of is comorbid with ADHD. We see it kind of go hand in hand a little bit. Oftentimes children that have ADHD that has the behavioral issues, it can be labeled as ODD because they oftentimes present as defiant, oppositional, argumentative. They go into mood swings. They don't accept no as an answer. We see that a lot. Oftentimes they have lack of respect for authority figures. So parents, teachers, aunties, uncles, grandmothers. We see children often be defiant towards those type of role models that's in their lives. So oppositional defiant disorder, children have trouble getting along with other children. They throw tantrums. And these can be some older children. I call them teenage tantrums, even when they don't get their way. And we definitely see it quite frequently. They may oftentimes want attention, but they seek it negatively. That's seen a lot in oppositional defiant disorder. So those are some things that parents need to look for. But the arguments is number one, very argumentative. Maybe aggressive towards a peer or towards a sibling as well, because they feel like that sibling is taking their attention away. And there may be a little jealousy there. So you may see some oppositional defiant disorder because of that. And that's another common scenario. Home strategies, frequent redirection and consequences. The consequences have to stick. You can't say, well, you're not playing your game for a day. A day is not long enough. You have to reinforce those consequences for a good amount of time to make them know that, okay, well, I really did something wrong. So a length of time that will make them really realize. But oftentimes, sometimes with children with oppositional defiant disorder, we see they don't really care. You know, they'll lose their game or lose whatever they have, and they'd be like, oh, well, you know. I've had some parents to clean out their whole room and it still didn't faze them. So that's when we definitely want you to seek professional help. So therapy, we usually send them to cognitive behavioral therapy, first line. And we want to incorporate the family because the parents really need to be involved. Yes, the parents have to stand their ground because who's paying the bills? You know, definitely the child isn't. And with oppositional defiant disorder, that's, you know, I oftentimes ask that of my parents, who's paying the bills? Or the child may be sitting in an appointment with a cell phone. And I'd be like, well, why they got a cell phone if they're not listening to you? You know, take the phone away, turn it off, shut it off. And I make them shut it off in the appointment. They have to put it away. Because why are they seeking help? If they're having behavioral issues, there's two theories that we see to oppositional defiant disorder. The first one is that it's developmental, that maybe children and teens, they may have trouble learning to become independent from the parent, and or they may be emotionally detached. So developmentally, they didn't, the developmental behaviors lasted beyond the toddler years. So sometimes we have parents come in and say, well, this has been going on since they've been about 2 years old and they just never got out of it. They just never could accept the word no. And, you know, I just don't know what to do. That's one theory. So we oftentimes tell them, well, you know, what have you done to make them understand? And we tell them, if you don't do something now, what are you going to do when they become teenagers? That's the first one. And I see a question here. What are your thoughts on medicating? We do medicate ODD. Sometimes we do. If it's too far out of hand, we do. The learning theory. So sometimes children have learned behavior. So we all know children are sponges. They look at us, they learn by repeating things that they see other people do. So sometimes children develop this from someone that they've been around that has not been such a good influence in their life, and we see it become that way. Anticipated testing. Usually psychological evaluations, even I can diagnose it by just a background of different characteristics and symptomology that presents to me. So that's you know, a couple of ways of looking at it. And management of it is, like I said, therapy, making sure you instill the consequences. Family therapy is always best. And we do provide medication for the aggressive behaviors that we see that coincides. So that's ODD. And next is trauma. So you have a couple of things that go along with trauma. Trauma is, a lot of people, when they hear trauma, they think of post-traumatic stress syndrome. Well, there's a stage of that comes before post-traumatic stress disorder. The first stage is called acute stress reaction. And what I want you to understand with that is, say that a child has been in a home where there's some domestic violence, where there's a lot of arguing, there's a lot of, just fussing and fighting. Then that child may have what's called acute stress disorder, and that lasts about a month. And if that child has symptoms of being really anxious, not wanting to go around certain people, isolating, crying a lot, just being in a state of fear, being really fearful, may wake up saying, I have nightmares and things of that nature. Then we diagnose it if it's been, like I said, in that first 30 days of acute stress disorder. If it's past 30 days and they present to us, then it's considered post-traumatic stress disorder, if the child continued to have those symptoms. So children can be traumatized by a lot of various ways. A lot of times, like I said earlier, they can be bullied. They can be in the domestic violent home. It could be in a situation like that. It can be verbal abuse, emotional abuse, sexual abuse. We've seen it all. A lot of sad stories. So trauma is real, is here, and is really, really unfortunate. Home strategies for trauma is letting the child know that they're safe, that nothing is going to happen. The behaviors or whatever traumatized them will not be repeated. And getting them to understand is very difficult. A lot of children will develop depression. Some develop severe anxiety when they've been traumatized. We've had some children to even disassociate. And disassociation is when a child may hear voices, they may hallucinate. They may make up an imaginary friend to escape the trauma that they've experienced. So there's various ways of the various presentations, that we've seen. But in the home, it's just basically reinforcing that they're in a safe place. When to seek professional help is when you see that the child is not getting any better. They need therapy. Any child that's been traumatized needs therapy. There's no way around it. I don't think that treating it at home is the solution. They need therapy. So trauma-focused therapy, there's a few therapies that are catered towards treating trauma. This whole COVID area was traumatizing. Yes, it was. It most certainly was. Loss, sickness, uncertainty. I had a lot of seniors that was very depressed. They didn't know what the future was going to hold or how they were going to pursue college during COVID. It was very sad. And they were traumatized from it. Anticipating testing, when we diagnose it based on time frame, duration, and exposure to trauma. Management of trauma is oftentimes a person that's been traumatized. Therapy is first line, but medication may be warranted. So that is trauma. Grief. Grief is when a child had grief. We all know what grief is: grieving someone's loss, and just feeling sad of a person's absence, and in death and dying. That is never easy. We always say to people, even, us as adults, we always say, well, my condolences go out to you. I feel sorry. People are around for a while, and then when the people go away, we even suffer. So imagine a child, how they perceive it. Very difficult, because a lot of times, depending on their age, they can't really process the loss. Or if they're even a teenager, it's hard for them to deal with it. Signs and symptoms of grief may coincide with depressive symptoms, or them constantly saying that they miss the person or miss the loved one that they lost. They may appear as very isolated, sad, not wanting to do things. They may ask for the person that's gone a lot, or they may ask questions about where do a person go when they die. They may ask questions about heaven, what is heaven? They may ask questions about what is hell. It just depends on the household and what a person's personal beliefs are. Also, when to home strategies is just basically letting them know, depending on how comfortable you are having that conversation with your child. Some parents are comfortable sitting down trying to explain that to their child, and some may not be. It just all depends on the individual, what their beliefs are, and taking it from there. I oftentimes say, well, you might want to explain to them, we were born and, we have a birthday. And one day, we're going to all leave here, but it depends on what that child's age is. So you may not want to go into that talk with them until they can have some logical understanding. When to seek professional help is when it impacts the child's daily functioning. If the child is going into a depression because of the grief, you need to get them some professional help. There's a good service that hospice provide. It's called Kids Path. And Kids Path is grief counselors that are set up that's catered just for children. And they help with grieving. I think they also help with adults too, but they will help children cope with death and dying. Also, you have therapists that provide grief counseling as well, and do a very good job doing so. Anticipated testing, I think it just seems as past symptomology, the duration of time. We have grieving. Textbook says 2 years. We grieve for 2 years. After that, anything longer than that is complicated grieving. But people grieve at different times. They grieve in different ways. Complicated grieving is when you see people going out and they're doing extreme things after losing a loved one that doesn't seem quite ordinary. So, but grieving can mean different things to different people. So, like I said, I really don't knock people for it unless it impacts their daily functioning to where they're not getting out of bed, they're not going to work, they're not taking care of their family, themselves, and things like that. So, in management of grief, counseling, therapy, and sometimes we do offer antidepressants for people that is in complicated grieving. But for children, it's the same thing. And that's it. That's all I have.
Thank you, thank you, thank you. Crystal, you did a phenomenal job. Thank you so much for giving us insight, for giving us knowledge, for imparting resources in us this evening. I don't know how anyone else feels, but I know even sitting here, listening to you, receiving from you, I feel a bit more empowered to be able to advance. I know that's the theme for this month. When you talk about advancing, you start thinking about knowing where you're going and knowing how to move. And so it's important. Just a few things I think that are major takeaways for me. When you talked about paying attention to our children, is so important that we know our kids. Sometimes we're very caught up in our busyness, as you mentioned, and what we're doing. And so it's important that we know their cues, that we know them, that we know their moods. And you talked about having non-biased and independent evaluations is so important, and to understand that we don't have to wait on the school system. When we suspect something, it's okay for you to go to your provider outside of the school system and say, hey, these are my concerns. Can we follow this up? You don't have to wait for the teacher to come to you and say something's going on. Or if the teacher does come to you, it's okay for you to say, okay. The I'll take care of it is not just home and disciplinary issues, but the I'm gonna take care of it is also I'm taking you to the doctor and we're gonna follow this up. And then with the results and the things that I find out, I'm gonna decide how to go back to the school if that's even needed, because I may not even need to involve them based on what we do here at the house. The last thing I just appreciate and want to acknowledge that even in what Crystal does, it is indeed a gift and a ministry in itself. And so tonight, even with what she's given, please make sure that you guys sow into the sister circle, being able to pull Crystal and other people like her to the forefront to be able to share and have this platform. And not only that, but even a number of other things that the sister circle is working on. And tune into the town hall because you'll be hearing more about things that are coming down the pipeline. But even in psychiatry and behavioral health, I recognize that Crystal operates in a gift. And also, remember to complete the survey, please, for this evening. Extremely important. We want to know how this was useful to you. We want to know who you guys are and how this appealed and helped you. But she operates in a gift and a ministry. And I can't do what she does. And I appreciate having someone to work with that is indeed complimentary. I remember a day coming in here and a kid was growling. I'm like, Lord, I need some oil. Where the oil? And I'm like, close the door because I ain't fasting and prayed up for this. But to see her navigate that and manage that in such a personal and professional way was indeed beautiful. And to do that in a way that makes a difference in that person's life, not just I'm gonna throw medicine at you or whatever, but to relate to that person, was just beautiful and phenomenal. And even this evening, we had someone come in and said, you know what, thank you. You know, I'm walking in hope and I'm walking in my future. And they were saying that because of what you did, and with the therapy and even with the medication, and they were quoting scripture and talking about Jeremiah 29:11, and how, you know, God knows the thoughts and the plans that he has for me, plans to prosper me and not to harm me, and to
Yeah.
give me a hope and a future. And they were just so grateful and appreciative about how even receiving these services brought them to a place of where they said, I'm now walking in my hope and my future because of the difference that was made. So I just want to say, from my perspective, working in a different discipline that is not behavioral health, psychiatry, all that. I value it. I appreciate it. Mental health is important, and we got to take care of our babies
Yeah.
and our children because they're up next. So this has been wonderful. I have enjoyed receiving. So again, so support. And thank you guys for this evening. Thank you guys for tuning in and hanging in there with us. Enjoy. That's it.